And welcome to another episode of More Than Therapy. Today we're going to talk about sexuality, well, actually, sexual identity and the impact on mental health. Sexuality is a complex and personal topic, and its impact on mental health can vary depending on the individual. However, there are some general trends that we're going to observe here today. A quote: everyone has a spectrum of masculinity and femininity inside of them. And every individual, a war of misogyny is raging. Every man is repressing and oppressing the femininity within themselves, raising up male values as governing values, because that's what we've been taught to do. Just as every woman has. Misogyny isn't just something that affects women, it affects men. A quote by Hani. Today's guest, I'll have Al introduce her.
Yeah, so today's guest, we have a licensed therapist from Maryland, and I apologize if I mispronounce your name, but is it Tawaka? Is that how you? Okay,
Correct.
Tawaka Philon, correct?
Yes, Tawaka
Okay,
Turner-Philon.
okay, I apologize, Tawaka
No worries.
Turner-Philon, and so Tawaka is a therapist that's been licensed, been in the profession 20 years, and she can tell you more about that. But I just want to kind of just briefly say it's interesting how this actually came about. We was just talking before we started recording. I actually know Tawaka from a childhood friend, one of my older brother's good friends from childhood that I've known literally all my life. We kind of was talking on social media. He told me that his wife was a therapist and had 20 years experience. So I thought it'd be interesting, to have her on and get a female perspective, on this sexual identity or as it relates to sexual orientation and the impact that it has on mental health. So without further ado, Tawaka, please tell the people a little bit more about your experience and your background.
Absolutely. Thank you so much for the introduction and for this opportunity. So I have been working in mental health for like almost 20 years since I graduated from Alabama State in 2003 with my degree in psychology. I also have a master's degree in clinical mental health counseling. So I've been practicing as a mental health clinician like that has been my only job because it is my belief that I was created to help others know, understand, and to release their greatest potential. So my last venture since 2018, I worked with first responders. So EMT, EMS, and the population was like 90% white males. And so I had the opportunity to kind of hear about the vast experiences that they have not only in the fire service but prior to. And so sexual orientation, sexuality, all things sexual have come up, and how it's connected to their mental health and how just the transition that has happened. But over the 20 years I've worked with all populations from females to adolescents. So I have a vast experience in just hearing the different perspectives from female, male, from, gender fluid, from, I worked at a women's center where we actually had, trans clients that would come in with crises associated with their sexual orientation, sexual identity, sexual preferences, and I'm just looking forward to kind of digging into this with you guys, just to bounce the ideas off of each other.
Indeed. First, we're going to talk about the pros, the positives of being comfortable expressing sexuality. When I came to America, sexuality seemed to be more compressed, more not so much discussed as it was in my native country. And it caused some conflicts between my siblings and myself regarding like going to school, regarding the interactions we would have with other people. That's where I'm from. We're a very sensual, very loving community versus in America, at least where we were in the South. They were kind of like more stuck, kind of more da-da-da. They did what they did, but they did it behind closed doors. You didn't really see them be enamored with one another publicly, per se. In fact, I wasn't really exposed when I came to America. Wasn't really exposed to PDA or anything like that. They just seemed to be like the oddest concept amongst Black and brown people. which is a direct conflict where I'm from. Versus you would see that on the other side. You would see the Hispanics do it. You would see the Caucasians do it. You would never see the Asians do it. But yeah, that was just something that I observed, that, the positivities of it is just improved interaction with yourself, in my opinion, and the community that you live in.
Yeah, I think that's an interesting perspective, Felipe, because I know you're Haitian descent, correct?
Mm-hmm.
And that plays a big part on it, culture and things like that, right? Like culture, identity. So I think it's interesting when you talk about being comfortable and the pros of expressing it. And if you kind of look at the trend, like anybody that's in this professional line of work, any therapist, a counselor, anything like that, if you kind of look at the trends over time in like American social issues, that stuff is starting to change, right? It's a lot of laws now, a lot of local ordinances and stuff in terms of like anti-discrimination based on sexual identity and things like that. But that wasn't something that was always coming. People wasn't always comfortable expressing their sexuality. In fact, even in some cultures, like I've worked with some people that was from Jamaica, and I remember talking to a guy once and then looking at some stuff online, and like that's like a culture where you expressing your sexual identity, you can actually be killed. I had a professor in graduate school. He was Jamaican, Dr. Williams. Shout out to Dr. Williams over at ANC Central, Central University Social Work Department. But yeah, I remember having a conversation with him, and he was telling me like over there, that's very, very taboo. If you are a homosexual, that's just something you just can't openly express. You know what I mean? For fear of being assaulted, killed, bullied, all that type of stuff. And you see some of that here too. So I think that's interesting that that's something that people have to actually consider before coming out of the closet, if you will, or being comfortable expressing their sexuality and stuff like that. So yeah, you have to definitely look at those pros and cons when you think about that.
Absolutely. A lot of that culture. I'm sorry.
No, go ahead.
A lot of that cultural impact is because of colonialism. They were raped, they were pillaged, they were abused. And therefore, when remember, Jamaica was the first African-based nation to break away from slavery. They raised farms and said, you know what, F this, we're not dealing with this. They see it almost as it goes against them. You know what I'm saying? It was an enemy of them. So therefore, because they saw the colonials do it as righteous they were supposed to be based on their religious pilgrimage to America and to the islands. It was all because they didn't want to pay taxes and wanted to do what they wanted to do. How can you enslave a man and say that you're a god? Anyway, that's another
subject. Oh, you felt passionate about that, didn't you, brother? But thinking about like coming from the cultural norms, right? So I have a present client that is from African descent, so he's Nigerian, and so there are a lot of gender roles associated with like how you grew up, where you grew up. I'm from the South. I'm from actually born and raised in Georgia, and so there are religious ideas that are associated with your sexuality. So when you grow up in a family or a household that has, the man as dominant, the head, the leader, the woman as the nurturer, the heartbeat, then there are instinctual role identities that like there's this unspoken expectation. So if somebody is growing up and they are thinking like, okay, my sexual identity or the way that I feel sexually is not in alignment with what my parents are teaching or with our traditions or what the church is saying. So they have to, it's like a learned helplessness where let me just keep it under wraps, going back to that slave mentality where you can't express yourself, you can't really experience sex and how it was intended without repercussion. So let me just keep it under wraps. Let me not say nothing. Let me hush my mouth because I don't want the stigma. I don't want the fight. I don't want the suffering and the pain. And so it's associated with like generational trauma, traumas that where we may not have experienced it personally, but hearing about it, knowing our history, is like, no, we can't talk about that because I'm going to get disowned. I won't get my inheritance. I'll shame my family if. So yes.
Yeah. You're right. That's heavy. That is real heavy. Because you're right. A lot of that stuff is associated with generational norms and beliefs. Oh, we don't do that in this family. We can't. But just imagine that though, not being able to truly express your sexuality, right? Not to be able to be comfortable in it. And it's interesting because this thing is bigger than people think, y'all. It's so big and so necessary that the American Psychiatric Association is so fit to actually put this in the DSM-5 as a disorder, right? Gender dysphoria. That's a real disorder, right? And I'm fairly new in terms of just being familiarized with it. When I started to really pay attention to it is when I started working as a forensic social worker in a prison setting, right? Doing group therapy with inmates, individual therapy and things like that. And so I started learning about a little bit more about it just from treating transgender inmates. But this thing is so real that PhD psychologists and psychiatrists feel the need to make this a real diagnosis. So not being able to express your true sexuality is enough to cause discomfort, feelings of discomfort and distress, about your gender identity if it differs in your mind from what you were assigned at birth. That's a real disorder. So I think that alone speaks volumes into the importance of being able to express sexuality. You know what I mean?
Absolutely. Like being in a space. So I have 3 teenagers. Don't judge me, but my kids are 15, 16, and 17. Just had birthdays, and a birthday is coming up. And so we've talked about sexuality, since they were like in middle school. Like I have an open forum where they get to share their truths. So I've had questions like, Mom, what would you do if I like girls? That's my daughters. Or my son has never said if he like boys, because he's like, Mom, I just like women. And I'm like, okay, good. But my girls now have been more associated with just like what's going on, social trends in media. So now they're like experimenting mentally. Like, I don't know, Mom, she's pretty or she's beautiful. I was like, well, baby, if you're not thinking about having sexual intercourse, you can't determine what your sexuality or your sexual orientation or your sexual identity, right? Like, that's the whole thing. It's talking about sex. You're not thinking about sex. So we don't even have to have this conversation to be something almost just to stoke the fire, right? Like for the cliches of it, for just to have something to talk about. And so like I've learned that sexual identity and the impacts on the mental health are almost the same impacts as someone that is biracial or that is multicultural and really don't know where they fit. And so like I've encouraged people, like, stop trying to fit into, if you're gay, then you're supposed to. If you're straight, then you're supposed to. If you're cisgender, then you're supposed to, right? The supposed to's is the cognitive distortion, where we are kind of regurgitating what the people have told us. We are regurgitating what the social media and what's out there in mainstream. And so when it comes to the clinical part of it, like you mentioned, it being in the DSM now, because it's so fluid, right? There is no solid, there is no black and white. It's hard to really focus on it, especially when people run to my parents said this, and because I don't want to do what my parents say, so they run to the opposite end, and it becomes overcompensation to break out of a mold, but to still put themselves in something, just to feel a part of or to feel accepted. So it's definitely about like self-acceptance.
I pretty much agree with that. What about you, Felipe?
I agree as well. Acceptance is very important. No matter, you are a person first. You're a human first. You know what I'm saying? Why aren't you being embraced for being a human? If you're a good human, that's what you should be valued for, regardless of your sexuality. Your sexuality should not define how good or how bad you are, unless you're doing maladaptive and negative behaviors, especially towards others. It reminds me of sloppy segue. I had a therapist that was identified as they, them. And I found it very difficult to engage with them not because of the sexuality of this individual, but because I had the most difficult time with pronouns. They insisted on they, them. English is my second language. It took a long time for me to know how to work the pronouns for your language. And then from now, I have to retrain my brain, which is harder to do as I age, I must admit, to utilize pronouns in ways that don't make sense. Where what I learned about your country is they means more than one. Them is more than one. Why am I calling a single person they, them? I can't wrap my head around it. I reached out to a person who's on transgender to ask them if he's a therapist. They are a therapist. See what I'm saying? Can you point me to some trainings, to some seminars, some workshops to help me wrap my head around it so I can be a more well-rounded clinician? Because I'm really having a lot of difficulty with this concept, and I have to be honest with myself. And I say this, and I hate that I have to be so transparent, but I think it's very important to be my true, authentic self. We're all not meant to do everything in therapy, and that's just something that I would like to be more familiar with, to be more helpful with. It will never be my specialty, I'm sure, but what if somebody comes to me for crisis and I need to work with them and help with them? Because I used to do mobile crisis. I'm thinking about doing it again. I want to meet them where they're at and be accepting of them. And apparently their pronouns is a part of acceptance. Unfortunately, this clinician cannot give me any resources for workshops, seminars, or anything like that to assist me with this. Apparently these trainings do not exist, but they need to.
Absolutely.
Yeah. Well, just to piggyback off that, Felipe, again, this is a very interesting topic, right? With a lot of different angles. But you're right, man. The resources are just scant when it comes to trainings for clinicians on dealing with sexual orientation, treating mental health, sexuality, that type of things. And I think a part of the reason is just based on what I read is a lot of clinicians just aren't knowledgeable in that area. And it doesn't seem to be an area where a lot of clinicians are kind of trying to make a lot of, they're trying to break ground, for a lack of a better way of putting it. It's like people want to, I guess, because if you're not treating people that identify as LGBTQI or whatever other letters I'm leaving out, I apologize. I guess it's not a concern of yours, but it does help because we have colleagues, right? We have licensed therapists, colleagues that work in the field. And so it's good to be knowledgeable, but I think the best way to kind of work around it is to always ask. And that's what I do because it's tricky now, right? With all the different roles and titles, right? So I have a policy where I just ask with all the pronouns because you got pansexual, you got binary now, you got gender fluid or whatever. So you got all these terms, bisexual, and it's some overlap in some of them. You got all these different terms now, and so it's best to just ask. Like, because I mentioned this to you before. Like, I work at an inpatient facility. I'm an assessment clinician, so I work with children that range from like 4 to 21 years, and so I meet a lot of kids in that age range of like 11 to 15 that have like sexual identity issues. So there are a lot of people tell me like, I don't know how I identify, or I identify as non-binary, I identify sexual fluid, pansexual, this or that. So I always ask because I don't want to, offend anybody, and I prefer to call somebody the way they prefer to be called, because that just helps with the therapeutic alliance and treatment and stuff like that. So I find that it's best to just ask, man, because you're right. It's tricky now. You got all these different terms and titles, and it just makes this whole ideal of sexuality and sexual orientation that much more tricky. And if you're working in like what we do, it makes a difference to understand. And it's big. It's big. I'm seeing a lot of that, because I always ask like, well, how much of the way you identify your sexual orientation is affecting your mental health? And I'm always getting like a host of issues. And it is some literature out there to back that up. And so I'm pretty sure, Tawaka, that's something that you probably done experience with as well.
Absolutely. So one there isn't a lot of clinicians kind of stay away from it because it challenges our own biases, right? And so if we're being following our ethical code, then we're not supposed to kind of project our biases. So because it's a sensitive subject, there is not a lot of concrete information on how to deal with it. Just like back in the day where we had to do multicultural trainings and diversity trainings and inclusion, right? So we're learning all of that. The LGBTQIA++, I think I got all the letters. Like that is something that's new and up and coming. So we're continuing to do more studies on it. So actually clinicians that are part of that community, they better serve others that are struggling with those types of things just because of being able to relate and being on the same like path. But like with my assessments, we do ask about like your sexuality, your sexual orientation. How does it affect your mental health? How does it contribute to your depression, your anxiety? And some people are actually ignorant to the fact that their sexuality contributes to their anxiety and depression, right? Because it's almost like an iceberg situation where the maladaptive expressions and the maladaptive ways that they cope with life experiences in general is so convoluted, and there's so much comorbidity where there's multiple things that are happening at once. No one kind of knows what came first and what's connected to what. And so I kind of stay away from the pronouns because I just ask you, what would you like me to call you? Like, what would you like me to call you? What name? And I focus on empowering them to accept who they are, the name that they choose, the name that they want to go by. And that's where we go when it comes to like establishing that therapeutic relationship where I'm going to call you what you want me to call you and the reasons why and how you got to this and your confusion about it, my confusion. We don't even have to go there because it's secondary to what the issue is. I literally had a client that was reaching out to me for services, and he was like, do you provide services to gay Black men? And my response was, do you think thoughts and do you feel feelings? Well, I can service you because your sexuality and your has nothing to do with what's going on in your psyche and your ration mind and your emotion mind and, the internal conflict, right? Like we can talk about your sexuality, but that's secondary. Let's not make that the main thing. And it ended up, as we got into our sessions, like I asked him, like, are you comfortable with your sexuality? And that thing messed him up. That one question caused him to go down a rabbit hole. And we kind of dissected where just because of him not really being comfortable, even though he was out, even though he had told his family and friends, oh, I'm gay, right? He accepted that title, but he didn't know how to be. Like he was doing things. Oh, if I'm gay, I'm supposed to do this, right? Or I am still a man, right? So that's where his internal conflict, how do he accept his sexuality and still experience life in his manhood? So what do y'all think about, having a title and then just having your instinctual, biological, and your testosterone called you to be away, right? The estrogen caused you to feel away. So how do y'all feel about that part of it?
I feel that, unfortunately, even if you feel feminine or you identify as you want to be, your gender is female, but you were born biologically a male, you're still biologically a male. Well, I'll give you a perfect example that I've seen recently. A person who was born biologically a male presents as a female, dresses and everything. But when somebody bucked at him, you've seen the masculinity traits come forward. He was strong. He beat the person up that you would think no woman that I know could have beat that person up, but half the population of men probably could. And that particular person who was born a biological man was able to. I'm not saying that people can't fight or women can't fight or transgenders can't fight. All I'm saying is their testosterone is a big impact. And if they're not taking the right medications to bring it down, if they're not getting the right hormone replacement, then of course it's going to be, that's still who you are, We see it a lot in sports now. I've never seen it on a personal level, just on, television and documentaries and stuff, and where they're taking over women's sports. But you've never seen a transgender man go to a woman's sport, or however you're supposed to say it. You've never seen a person who transitioned to be a boy from a biological female go to a man's sport like basketball or wrestling or anything like that. But you often see a biological male who's transitioned into a woman or has transitioned go to those sports. And I find that very problematic.
Not yet. We haven't seen yet. I'm sorry, Tawaka, but that's funny because we haven't seen that yet, Felipe. You're right. Every time you look at a news article now and you stay up to date with the current event, you're seeing another case of backlash or outcry from the public about a male that was born, signed genitalia at birth male that is transitioned to a woman in women's sports and has won something. I've seen about 3 or 4 cases of that lately, and you're getting backlash. You're getting outcry from female athletes and supporters and the like to say, hey, this is not fair. This is this is that. But again, I mean, if that's how a person, identified, they have transitioned, and if there are no rules in place to say, well, if you transgender female, from male to female, that you can't play the sport. If there's nothing like that, and I don't even know if that's possible to do. Maybe you can and if it's something private. But then, who's to say that who's going to keep out somebody that was born male, transitioned female to play a female sport, right? So. But you're right. You usually see more of that born male transition female as opposed to born female transition male and competing in male sports and winning. But that's interesting because that's been a hot topic lately. There's been a lot of stuff in the media about that, which kind of is a perfect segue to kind of mention the role that mainstream society in the media plays into identifying, with your sexuality and mental health, because I think that's a big part of it, right? It's a lot of mainstream influence from the public that influences that. And one of the things right off the bat that comes to mind for me, Felipe, in our home state here in North Carolina is HB 2. And Tawaka, you may be familiar with this House Bill 2, also known as the Public Facilities and Privacy and Security Act, which was introduced in the North Carolina, General Assembly in 2016, and it was a bill that got a lot of backlash. Got a lot of backlash from politicians all over the country, including the president. At the time, Barack Obama spoke negatively again of the governors of the state. But basically, Tawaka, that was a bill introduced here. We called it the bathroom bill that pretty much precluded local governments from creating anti-discrimination ordinances and stuff like that. And it pretty much said that you had to use the restroom that was your assigned gender at birth, even if you was a transgender woman, right? And you was born a male, you had to use a male restroom, and that caused a lot of upheaval in the transgender community here, and advocates and supporters of that, because it was a big deal. It was a big deal. In fact, it was so big of a deal that the governor at the time, Pat McCrory, who was a Republican governor, he lost his bid for re-election because of that. Our state lost a lot of money. It was like $400 million, if I remember correctly, was the estimate from employers pulling out, events canceling, things like that, jobs coming here that changed their mind because this law was extremely anti-LGBTQ is what a lot of people felt. Forcing people to you. And then another issue was a lot of local law enforcement departments well, how are we going to enforce this law? They didn't want to expend resources to have people monitoring restrooms 24/7. So that was a problem with it. Well, how are we going to enforce this law? Because basically the law ultimately ended up being repealed, the whole law. First, the bathroom section of it, then the entire law in 2020 was repealed and replaced with another bill. But it was an outpour because people was complaining well, how are we going to enforce this? And because basically they were saying that if you was born male and you transgendered to female, if you still had a male genitalia, which a lot of transgender females do, then you needed to use a female restroom. And I read one study that said a transgendered a suicide hotline, the phone calls doubled to that hotline after this bill was introduced. Where a lot of people having anxiety, depression, just stress. You know what I mean? So we know this stuff impacts mental health. You know what I mean?
Absolutely. It's almost like when somebody has assumed an identity, then there is nothing that anybody can do to convince them otherwise. So for someone that's a trans woman and she looks like a lady, she has her breasts, she has her, her makeup and her dress on, but she hasn't completed like the gender reassignment surgery, and she has to go into a male's restroom. Of course, that causes the looks from the men. Maybe that person didn't want people to know, right? Like it's a hard line to a path to follow. And so like now, there are restrooms that are both genders or gender neutral bathrooms, and they have actual stalls. Like I do a lot of traveling, so I've seen airports where it's just you go in there and like, oh, everybody goes into the same bathroom. Right. There are stalls that you're all individual. You can't look under it, you can't look over it. So that is one way that society has kind of been more inclusive and considerate and being empathetic towards the trans community by just making things more inclusive.
Absolutely, yeah. That's interesting though. That's an interesting take to see that, because and as clinicians, I think it's important that people realize that, like, we're not in the business of taking sides with anybody, whether you heterosexual, homosexual, pansexual, gender fluid, whatever. That's your personal preference, right? That's a preference thing. So people don't get it twisted. Folks may think like, oh, if, a good clinician is not in the business of taking sides. We're in the business of just treating people, and based on whatever they're dealing with mental health wise, whether your sexuality is influencing or not. We're in the business of treating folks and teaching folks how to live better, how to cope with things, how to respond to things in a better manner. So that's what we're in the business of. So and that's a part of culturally competent practice, right? And that's why I always say, like you mentioned earlier, Tawaka, getting the names right. I mean, that's important, for a person to be recognized the way they want to be recognized. And like you said, Felipe, you have trouble. Well, what pronoun that are you? That's why it's best to just ask, and that's what I always do. Well, what do you want to be called? Because again, that's a part of culturally competent practice, right? Understanding other people that are different from us, right? Whether it's a cultural or sexual orientation or race or age, right? That's a part of that culturally competent piece. So we have to just make sure as clinicians we're getting it right, or trying to get it right, as it relates to treating our clients and the populations that we serve. The population that we serve, rather.
So like working with the fire service, it used to be firemen, but they changed it to firefighters because of all of the, like, women can be firefighters too. But at the facility that I worked in, which is in Upper Marlboro, Maryland, it's a residential facility for the International Association of Firefighters from across the nation. So anybody that's a part of that union can get services at the facility. So the facility is brief intensive therapy, 5 to 7 weeks, where they get all encompassing. So they get psychiatric services, medical services, clinical services. They stay on campus. Come here, get your help, or you might lose your job. And I found like the females that come through, the ones that don't tap into their masculinity, struggle a lot because of not being strong enough, fast enough, feeling like they can't do the job, right? Petite or whatever. And then some of the ones that are more that took on a more masculine identity, so then they became in competition with the other men. And I had to help them understand that your path and your, like, be in competition with yourself, be the best version of you, do the job that you can do. And if you can't do it, then it's like you can't do it. If you're not the one that's going to be on the lead of the hose, because the hose is, whatever the case may be, why are you fighting to match the strength of a man or the strength of somebody that's stronger than you, whether it's same gender or not? So like really challenging how the ideas of your job or your occupation and a male dominated profession versus a female dominated profession, and how does, do I have to be masculine in order to be great at my job because it's a male dominated? So police officers, military, like those public servants, struggling with the idea that they have to meet something in order to qualify. And so the women come in like really beat down and burdened because they aren't as strong as, or they hurt themselves and they mess up their bodies in order to train to be more than what they are. And it's like that Southern girl in me, and I am pro woman, but I'm also pro man, right? And so it's like, be who you are, do the thing that's good for you. If your body, if your competency, if your physical strength does not equate to what you're doing, then why are you putting yourself through this suffering? Because suffering is a choice, right? Pain is inevitable, but we choose to suffer just to prove a point or to negate a fact. Like, it's not even worth it. Like, are you really satisfied with your life that you're burdened when you show up because you were trying to force your way in a space that wasn't actually designed for you? But that's a sticky subject too.
Yeah, that is interesting. That's interesting. Yeah, it is. And I'm sure as a Black woman working with, because you said you work with predominantly white males in the fire department, right?
Right.
Yeah. That is. It seems like it would be. I don't know. Like I don't think I probably could do that. I think it just probably because of the cultural differences. I don't think I would connect. But as a Black female, you probably doing some good work up there. You probably didn't think you would be able to connect with, some of the populations that you're serving right now.
So to be honest, that's kind of why I had to transition. So I worked with the firemen since 2018, and I became almost like the token Blackness because of my energy. Because I show up, I am cussing them out, telling them like that was dumb, that was like working with the fire service to meet them on their level, like using profanity and really kind of letting them know like, no, this is why all lives don't matter. Like I've had to represent Blackness, right, since 2018. And so what I realized though, because of how exceptional, and the guys that came in, they are from across the nation. So as far as Washington State, some Canadians, like just all over. So I might have been their only experience of Black woman, right? And so they end up having this attraction, almost like invigorated, like, oh my God, you're so amazing. And I never met a woman like you. I'm not sure if I could have received this information if it was a Black man. Like literally having the audacity to really tell me their truth. And so I tapped into my generational trauma, like, I'm feeling like slave master, slave girl right now, right? Like I'm feeling that you're emulating me, that you're changing one addiction to another addiction, like you're addicted to the energy that my Black girl magic, right? And so like I literally had to pull back and I distanced myself. Right now I'm only PRN with that facility, where I'll go in and help when the campus needs something, or there are topics that they want me to facilitate in group, or maybe a clinician is out and they're having a tough time. And so like I literally would go in and show up, and it's like, oh my God, I've been here for 18 days and I'm just now getting it. And so I was like, I have to be unorthodox, because I will challenge your privilege. I will tell you that you're privileged and that you are taking advantage of a system. I will not play into can you say I have PTSD so I can get workers' comp? Like just random stuff, when it is your sexuality is what's in question, and you are a sex addict and you need sexual addiction, services. But because of the stigma, you don't want that to be on your file. I can't do it. I can't be your clinician. I can't sign off on this. So like it was really a challenge for me to always have to face them. So yeah, that's why I transitioned from full-time clinician. Now I'm a life coach where I can say no to people. Like I don't have to buy it into the system of medical necessity and playing the game that some people will use in order to get what they want, not necessarily what they need.
I can dig it. I can dig it.
Felipe, what's going on? What you feeling?
I'm so sorry that you went through that, but I can definitely see that. I like how you made the connection between the past and the present, as the past is ever present, which is why Florida does what it do regarding erasing the past.
For sure.
I said this. We live in some very interesting times. I've never seen a time as tumultuous as this one here, and I've been around well over 100 years. And it's scary. It's scary to have our youth, our children, grow up in this time of such things, issues, agendas that go totally against don't mirror what we experienced as children. Al and I spoke about this last week when we talked about bullying. Like the types of bullying we experienced or that we perpetrated is so much different than what the ones that our children face or will face. I believe that they're more sensitive. I believe that, but almost to the point where they're too sensitive. You know what I'm saying? I see a lot of crybabies in my practice. That, you know what I'm saying, that emotionally, how can they handle these changes in the world? And how can I, as a clinician, grow strong enough to be able to assist them with these transitions?
Yeah, man. Yeah, it is. You're right, man. We're in some times now that we haven't seen, right? We navigating some turbulent times right now, but that's just the way it is, man. I think if you just look at world history, it always kind of, you know, we gonna face times where things have been like uncertain, right? Because like, wow, we've never seen this before. There's never been a time in world history or you know, the history of a person's country where they've seen something like this, but it's real. And, you know, sometimes we just have to deal with it. We have to deal with it the best way we know how, because there are no rules and order in place on how to deal with this stuff. And it's kind of like it shows up and we trying to kind of figure it out as we go, right? And that's kind of the same way it is with sexual identity and the impact it can have on mental health. Because if you kind of look around, right, when you talk about like some of the issues people with they identify as LGBTQ face, obviously bullying is one issue that they face, right? And like you just mentioned, Felipe, we touched on this a little bit when we spoke about bullying. But it's not only bullying from peers and law enforcement and coworkers. It's also bullying from state government officials, government agencies. And I'll give you an example. If you do a Google search and you Google something like LGBTQ inmate sues state prison system, you'll get numerous articles and stories about litigation that's going on right now or in the past 5 years where there have been inmates, like LGBTQ inmates, that have sued the prison system that was housing them because of them basically a lack of what we would refer to as gender affirming treatment, right? So basically you have situations where, and there's been numerous cases where inmates that say transition from like born a male to female, where they want to be housed in a female prison, where they was either denied that, they was denied ongoing hormone treatments, they was denied protection and things like that, and they just was bullied by correction staff, prison staff, because of their sexual orientation. So you see that a lot going on. And I know here in my home state, North Carolina, has been a couple different big cases where inmates have sued state prison system and won. There's several right now you can Google, and they, you know, these state correctional agencies have paid out big bucks, you know, to settle claims of discrimination, bullying, denying healthcare, because that's pretty much to the point now where, like, if somebody has been receiving hormone treatments, you know, for the past 10, 15 years, they get incarcerated. The expectation from the healthcare side is that there are continue to get those hormone treatments if that is going to decrease gender dysphoria, right, and cut down on all that, because that's how they identify. But if you deny them that, you deny them a basic human right, you deny them a healthcare right and all that. So again, it's been numerous cases where people have sued state prison system successfully, and won. So that's just one of the issues we see people face, and again, it's very impactful on mental health.
Absolutely. I love that you brought up the systemic bullying, right? Like, it's from top down, and that's where it kind of leads from how society, how systems, healthcare, insurance companies, like just everything that could be considered systemic. And how that's how families, that's where they get their mentality. Like, I don't want you to struggle outside of my household, so I can't accept you really being who it is that you think you are. I had a son, and you're going to be a son, right? So the bullying, actually, it trickles down, and it starts at home. It's in the house, where the parents are bullying their kids, not in a malicious way, but in the best way that they know how, because they're trying to protect their kid or their loved one, because of, they know, like, once they get outside the house, how the system is going to treat them. And so it's a hard space to be in as a parent of someone that's struggling with their sexual identity, or a caregiver, or a sibling, or a friend, when it's like, do you not know the world don't accept you like that? Like, what are you going to do that you are 13 and you want to take hormone treatments you want to take testosterone because you don't want to be Brandy anymore, you want to be Elijah, and so we're going to call you him, we're going to call you Elijah, but your parents aren't going to pay for your testosterone because it's not a part of their insurance system. It's not basic health care, so it's extra, and they're not willing to, right? So there are so many things when it comes to the term bullying that we don't even think about, like, we don't even consider it.
We spot on with that. And I think we mentioned, when we had talked about bullying last week, I think one of the things I brought up, like you said, family, parents, a lot of people, bullies are their first parents, just not being, just denying their emotions, denying their rights. If your child is young, 7 or 8, 6 years old, they may be a child and you still providing for them and caring for them, but they still got feelings, they still got rights. So, whether it's not for me to say whether or not a parent should pay for a child to get gender affirming treatment at a young age. That's for that parent and that family, right, to decide what's best for their family. But I still think it's important to have conversations with children at a young age, especially when they start hitting that pre-adolescent, prepubescent age or whatever, and they start kind of liking or trying to identify, whether they homosexual, heterosexual. I think it's important to have those conversations, right? And how to do that is going to be left up to the family, based on like their history with their children, their culture, their spirituality, religion, all that type of stuff, right? It's going to play into it. But a conversation needs to be had, for good or for bad, on your child's sexuality. How do they see themselves, straight or gay? What are they attracted to, boys or girls? Because either way, whether you not supportive or supportive, that need to be had, because they need to know that, because like you said, they gonna have to deal with enough outside of the house. And it's interesting that you should bring that up, because and I had mentioned this last episode, that's something that my wife and I frequently talk about, like the sexuality of our children, when they get older, and because at a certain age, when children are 4, 5, and 6, they're not old enough to understand or have a sexual preference, right? That's too young to really understand what they mean. But a few years from now, when they start reaching 11, 12, 13 years old, they will. So I think it's important. And one thing that I think all couples should be able to agree on, husband and wives, wives, whatever, spouses, whatever, should be able to agree on that, okay, well, whatever we decide, or even if our views different, we should be able to go to our child and say, hey, talk to me about your sexuality. What are you attracted to? I need to know this as a parent, because for one, I need to be able to support you. And for two, I need to just be in the know, right? So you have to have those conversations. And I know those topics are difficult, but that's the only way to really support and you have to talk about this stuff, because if somebody don't feel able to voice that stuff in their own household and express it, then how in the world can we expect them to go out in the world and feel comfortable in their own skin and advocate for themselves and speak for themselves? So, that's one thing, we agree on. Well, if we're going to, be pretty on it. And I would much rather my child to tell me, hey, mom or dad, I think I'm gay. I think I'm attracted to this, so that we can be supportive and let them know, well, either way, we love you, but we need to have a conversation. It's going to be hard. You're going to face bullying. You're going to face discrimination. You know what I mean? Just to know that they're supported by their first teachers and stuff like that. So that's important to have those conversations.
Absolutely. Not only just to focus on their sexuality and how they express themselves, but actually having a safe space to tell their truth. Right? Like with all the hard topics, the same way we talk about the birds and the bees, right? Like, that you can get pregnant if, right? That same conversation has to be had where they have the information to make good choices, right? Like, it's yet to be determined, nature versus nurture, right? Are you born gay, or is it is it a product of your environment? Which is me. It's a combination. It's definitely a combination, and it's a combination of choices: what we feed, what we ingest, what we are surrounded by, what we're influenced by. It determines the trajectory of the things and the choices that we make. And so, like, being with your kids and allowing them to know, like, listen, I just want you to be honest with me. Be your authentic self. If you're going to make a choice, then make that choice and own it. Take responsibility for the things that you do, because secrets are the devil, right? Like, don't be out here doing stuff, sneaking around doing stuff, and I can't cover you. I can't support you because I have no idea. But, having those conversations, that's where the parents have to challenge their own biases, and they can't take it personal and right. Think that they've done something. I didn't protect you, or I didn't cover you, or what happened, or who touched you, right? Because that's where our head goes first, right? Like, something happened. Is this have you been traumatized, right? And so, like, just being able to create an environment where there is comfort in just telling whatever your truth is and being your authentic self and explaining what self-acceptance is and self-compassion, opposed to being critical and judgmental of self.
Indeed. We'll do a short commercial break and then we'll go to closeouts.
Sounds good.
Hey, boss. Okay?
I said I'm fine.
And we lost these.
Talk to me. It's been really, really hard for me.
Please, Al, any last words?
Yeah, well, of course, I want to thank our guest for being on here and sharing her insight and, adding, to the discussion. But I just, just going back off of what I was saying when we first started out, sexual orientation, sexual identity is real, right? It's so real that, experts felt the need to create diagnostic criteria for it and put it in the DSM. So I just think that we just got to be real careful when it comes to looking at sexuality and the roles it plays on mental health. Let's not downplay it, right? Let's not look at it like it's not a big deal when it is, because we have loved ones, we have children, we have coworkers, we have colleagues that are dealing with this stuff. And I just feel like, like I said, as clinicians, it's not our job to tell you how to identify what's right, what's wrong, right? That's your preference, right? Your preference is your preference. It's just our job to make sure we're fostering an environment, we're advocating for people outside of the mental health field to let them know that, you know, everybody deserves to be treated fairly, you know, and no matter what they, you know, believe in terms of their sexuality, whether they're homo or hetero. And it's not to be downplayed, you know, it's not to be downplayed, man. This stuff have major effects on people's mental health, and we just have to be aware of that, you know.
What comes to mind is a quote by Laverne Cox. She's a brilliant and thought-provoking speaker, Emmy-nominated actress, and documentary film producer. This quote goes as follows: "When I was perceived as a Black man, I became a threat to public safety. When I was dressed as myself, it was my safety that was threatened."
Mm.
Yeah,
It's a shame that we live in a society that has so much hate in their heart that they bring harm, whether verbally or physically, to others. This country supposedly was built on a foundation called Christianity. If this is Christianity, then I must become atheist, because this is deplorable. This is not of Christ. But then we must remember Christ was not a Christian; he was a Judas, and that the things that we do in this land are not reflective of his ways or his ideology of thought. This country is deplorable. It's funny how the ones that are the most hateful, the most violent, stand by the most obscure standards of their Christian faith and claim God as their reasons for doing it. We live in some very interesting times. Ms. Tawaka, any last words?
Thank you guys so much for having me. I've enjoyed our banter. It's been really good and invigorating. Just to, you know, iron sharpens iron, just leaning on each other. And one thing that I wanted to say, just from what Al said in his closing, people have to challenge their idea of what's right, right? Like, people are always trying to do the right thing, and that's where they expend so much energy and effort, because right according to who? Right according to society, right according to my parents, right according to my beliefs, whatever the case may be. But really focus on being your most authentic self, doing the things that make you happy, doing the things that allow you to feel fulfilled, right? The things that you feel like you were created to do, regardless of your age, sex, sexual orientation, race, ethnicity, fill in the blank. Like, everybody deserves to be treated with dignity and respect, period. And us as clinicians, we have to really be in the forefront of that, where we are allowing that person to have their experience and then letting them know that they just got to keep doing their best, not according to what people want from them. Like, stop trying to please people, because you never will be able to please them, and do what's pleasing to you. And then if you are a believer, or if you believe in a higher power, what do you feel like that purpose for your contribution to the world? What were you created to do? Do that.
Well said.
Indeed. Thank you once again, Tawaka, for your presence today. You are a breath of fresh air on this broadcast of More Than Therapy. If you haven't already, please subscribe to the More Than Therapy podcast, available anywhere that you push play to listen to your favorite podcast. That's the More Than Therapy podcast. Be well and be great.